Hello, everyone. My name is Leslie Dock. I'm the founder and chair of Protect Our Care. And along with our partner, Healthcare Voter, we thank all of our speakers and all of you who've joined us from across the country for this important conversation. And I also want to thank our panelists, who I think some of whom you see on the screen, Senator Baldwin and Senator Casey. And I want to thank the Executive Director, Brad Woodhouse of Protect Our Care, and our full team for helping to organize this event and all that they do. We're here today to mark one of the few happy anniversaries of the Trump presidency, the defeat of healthcare repeal on the floor of the US Senate 3 years ago tonight, in the wee hours of the morning of July 28th, 2017. Our conversation today is divided into two panels. I'll be moderating the first, and my colleague Adam Hoyer, who is the field and organizing director at Protect Our Care, will be moderating the second. In our first panel, we're honored to be joined by 4 US senators, some of whom will come in as they're finished voting on the floor. They are doing the nation's work, and who all 4 of whom led and continue to lead the fight for healthcare in America, and helped lead the fight that stopped repeal in the US Senate 3 years ago today. So please welcome Senator Casey from Pennsylvania and Senator Baldwin from Wisconsin. Our second panel will feature grassroots leaders who fought this fight on the ground alongside millions who made their voices heard. But let me now turn to our guests and begin this conversation. You know, since that night in 2017, the ACA has grown more popular than ever. It's grown more popular across party lines, and it became the issue that under the leadership of Nancy Pelosi won the House in 2018 and put Nancy Pelosi in the speaker's chair. And we've seen what that has meant for our country over the last 2 years. Because under her leadership, the House Democrats have fulfilled their promises to make healthcare better and more affordable. And all of us look forward to a time soon when the Senate will do the same. We're now in the middle of a pandemic, and the importance of the ACA has never been clearer and never more important. And yet President Trump continues to wage a relentless war on our healthcare, and he and Republicans in the House and Senate are still dead set in trying to take it all away. And now we're even before the Supreme Court trying to do just that. We will cover all this tonight, but let's start with that night 3 years ago. For me, I'll never forget where I was, pacing in my kitchen, walking back and forth, a computer in one hand and a cell phone in another. So much was at stake. So many people had worked so hard. We were optimistic, but we had no idea of the outcome. All of the members of the Senate seemed to be on the floor. The vice president had come to the Capitol for some last minute arm twisting, and none of us knew what was going to happen. All eyes were on John McCain when he entered the chamber, especially Mitch McConnell's. And Senator McCain, without saying a word, walked in, stood before the clerk, put his thumb down, and one of the bravest, most principled and dramatic votes ever on the Senate floor, stopped repeal. So like I said, let me turn to our guests, and I know that Senator Klobuchar from Minnesota has joined us as well, because they were, of course, there, and not in their kitchens like I was, witnesses and participants as they so often are to history. So I'd like to start with asking each of them just what it was like that night. Were you as nervous as I was and the rest of America was? And what did it feel like in the chamber when Senator McCain cast that historic vote? And let's start with Senator Casey, but please make this a conversation between all of you and not just a back and forth with me. But Senator Casey, we'd love to get your perspective on what that night was like.
Well, Leslie, thanks so much. I want to thank you and Protect Our Care and all those who will be on this call. So many people who fought so hard before that night when John McCain put his thumb down instead of his thumb up. It was a great moment for the country and obviously a great moment for healthcare. So we want to thank everyone who has worked up to that point in time and has never stopped working to fight against this terrible pernicious effort by Republicans to destroy the Affordable Care Act. That's what they're trying to do right now in the Supreme Court. And lots more to say about that, but just a couple of personal insights. Some of them very grave and serious, and some of them a lot lighter. Obviously, when I was walking over that night to vote, I guess it was about 1:30 in the morning. I don't know the exact hour, but it was really late. When I arrived, I got there a little bit early. People were just getting to the floor, and a colleague of mine, and I for history's sake, I don't want to say which colleague because I want to make sure I have this right, but my recollection is that one of my colleagues said to me, I think he's going to vote with us or something along those lines. And then, no, prior to that, someone mentioned something that he had said to them. That's what it was. And that led that person to believe that what he had said, even though it wasn't clear, meant that he would vote against it and vote with us, in essence. I heard that in the cloakroom, and there were only 2 or 3 people in there at the time. And because I am Irish and superstitious, I immediately didn't want to believe it, but I did not utter a word of that because I figured if I said it to someone else, it wouldn't happen. Of course, that's a little bit paranoid, but so I didn't know what to believe at that point because I was walking over thinking he'll never vote with us. I just didn't think it would happen. Based upon what he had said on Monday when he came back, when he had just left surgery, it just didn't seem like he was going to vote with us then, so I didn't think anything would change. And I guess I didn't want to get my hopes up. So I just stayed mute. And then when I went on the floor to just before the vote, and there was a lot of talking and tension, I heard someone else say, I think he's going to vote with us. And I just said, oh, really? And I just didn't even want to acknowledge that had happened. But obviously it was so important to the country. And I will say this about one aspect of it. That's just my theory. I can't prove this, obviously. But I think the fight on Medicaid was, if not determinative and decisive, pretty damn close. Because I think that fight on Medicaid from folks across the country, the disability community really worked so hard. And so many people who spend their lives protecting the vulnerable made Medicaid a central focus of that fight. And I think that had an impact on all three votes that we got. But that's just my recollection. I have more to say, but I don't want to hog the time.
We'll get some more, but also I think the Medicaid is what got all those Republican governors to call their Republican members of Congress and get them some on the right side. Senator Stabenow from Michigan has joined us as well. Why don't we turn to you and get your recollections of that night too?
Well, first of all, Leslie, it's great to be with you, and thank you to everybody with Protect Our Care, and to be with my wonderful colleagues, all of whom are great leaders in healthcare. And I just have to say, Bob, listening to you, I actually was one of the people saying that that night. I may have said it to you. I thought he was going to vote with. I thought Senator McCain was going to vote with us. I just had this gut reaction that he was going to. But when he walked on the floor, and I don't know if others have said this, but I literally was holding my breath. I don't know for how long. I mean, I'm sure you guys were as well. But I was just completely holding my breath. And it was so hard not to start cheering when he did what he did. And of course, with the decorum of the Senate, you're not supposed to do that, but we were all gasping at that point. And the other recollection that I have, and I think maybe Bob, you were with me, we walked out, it must have been, I don't know what time it was, 2:30, 3 o'clock in the morning, after this happened, and we knew that we had saved the ACA. We walked outside. And to me, what was the most profound recollection I had were all the people that were outside. They were outside the Capitol, and particularly our beautiful, blessed little lobbyists who were there in the middle of the night. I mean, they all these parents, these moms with their children that had many pre-existing conditions, children who were challenged and are challenged in so many ways from a healthcare standpoint. And these moms were fighting. And I think it was about 3 o'clock in the morning when we walked out to speak and thank everybody for staying there. And it was really, it was their victory. It was everybody's victory. It was everybody that's tuning in tonight who spoke up. And that was the victory.
Yeah, that's great. And the Elena Hung will be on our second panel, and they've done, put so much of themselves.
She was one of the people I saw. She was there.
Yeah, and I don't know how often this happens, but I remember Senator Schumer shushing people on the floor as the smiles began to emerge. So
no, most people are shushing him, is what you're
yeah, I imagine. Senator Klobuchar, I know that you've traveled a lot with Senator McCain around the world. What did you think of that vote and of him as a person and that night? And how courageous was it to stand up the way he did and do what he did?
Well, it's part really of what he's done is what he did his whole life. And I actually had a heads up. He whispered to me how he was going to vote before he did it. And I think I told Bob, but maybe not.
Yeah, are you revealing his source?
Well, we sit together, so which involves
she told me.
Sherrod, Bob, and I, with us always getting in trouble because Sherrod is talking. But no, he and I were very good friends, and it really, for me, was part of what I had learned about him. I actually took my first trip with him right after he lost to President Obama, and we went all around Asia. And I remember how careful he was to be respectful, how resilient he was after that. And it just was something that I'll never forget. And then this vote for him, of course, was personal. It would have been the thought that he knew that he was dying and that he was going to deny other people health care, just wasn't what he was about. And, he wasn't believed in everything that was in that bill, but what he did know that was that taking it out and getting rid of it was very mean-spirited, and he just wasn't going to have it. And then I got to actually go see him before he died with my husband at the ranch, and he couldn't talk very well, but I did bring up the vote then. That was one of the last things, and how brave that was. And he was in this beautiful, in his room, but the doors opened up into this creek outside of their ranch in near Sedona. And then the last thing he did when he just couldn't stop talking, he did yell at the TV a few times when his person was on TV, but I won't go into it. But he took out one of his books and he pointed to the sentence in the book, his own words, where he said, there's nothing more liberating in life than fighting for a cause larger than yourself. And I really think that's what that vote was about for him.
Yeah, he spent his life doing that. Senator Baldwin, I mean, we talked a little bit about the people waiting outside, and I'd love to hear your impressions of the night, but so many people on tonight were part of that. And the people get cynical and they wonder whether all that work really matters. I was wondering if you could also address that.
Yeah, well, let me start by just reflecting on what I've heard from my colleagues already is healthcare is personal. It's deeply personal. It's a vote like this is unlike the majority of votes we take. I'm not saying that other issues that come before us aren't personal and don't have major impact on people's lives, but we knew how consequential this was. And many of us, myself included, had spent many weeks, in fact, up into starting when the new president was inaugurated, knowing that this day was coming and doing everything we could to organize and help people share their stories. That's a powerful piece of this. I know when I was a child, I had a serious childhood illness and my family had trouble getting any sort of insurance for me in my later youth because I had a pre-existing health condition. And so this, working on forming and putting together the Affordable Care Act when I used to be a House member was one of the honors of my life. And I remember in committee, offering the amendment that allows young people to stay on their parents' health insurance until they're 26 years old. And what a difference that made for so many millions. And so all of this was coming together as we led up to that night. And so, yes, I felt nervous, but I also felt like we were that night doing the work to realize the dreams and aspirations of the hundreds of thousands of people we've been working with in our own states and who are coming to the Capitol steps, not just that night, for many nights in a row. And when he voted thumbs down, I felt this sense of relief for them as much as I did for myself, because there were going to be moms and dads with some peace of mind that they hadn't really had for months and months. I also, and I'd be interested in what my colleagues reflect on this, I can't remember at that moment when I thought, whether I thought that, well, the fight's over now. And the Affordable Care Act is going to be in place because we just voted against repealing it. Clearly, and looking forward to what your next panel will talk about, it's been chipped away at and chipped away at, and it continues even during the pandemic. There's the lawsuit, and it's making its way through the courts. But this president has sabotaged it at every turn.
Let's talk exactly about that. I'm curious what folks think about, first, if you're why. I mean, that night we thought, we had put it behind us. We almost beat it in the House. We just lost by a few votes. And yet they double down, yet they continue. They lose an election in 2018 over this, yet they continue. And none of us can really actually, in a way, it's bad politics, it's bad policy. I don't know if you have theories you're willing to share on why that continues, but also to talk about just here we are in this pandemic and what it still really means for people and the challenges we continue to face. So anybody who wants to go first, please just, Zoom will take care of quieting the rest of us.
Leslie, I was just going to add to the conversation about where we are right now. New York Times reported, I guess last week, more than 5 million people have already lost their health care. So the idea that you would continue down that pathway that Republicans have followed to getting rid of ACA, when even some in their own party are saying, why don't we use it now to cover people who aren't covered? Or why don't we do something with Medicaid? They don't want to do any of that. And look, I think it's real simple. And I know this sounds partisan, but it's just what I believe. This isn't a priority for them. I mean, let's think about it. Think about the last 50 years. When has the Republican Party made healthcare the centerpiece of a presidential campaign? I mean, like in a real way, like we got to get this done. Go back and look at Republican national conventions. They never talk about it. It's just not a priority. And so the idea that somehow there was going to be a replacement was just a lie when they told it, and it's still a lie. They're never going to have a replacement. This is not a priority issue for their party. Just as simple as that. So there's not a lot of room for hand-holding here. You got to defeat them, defeat their efforts, and make sure that people are aware what is at stake in the Supreme Court. Because if it goes the wrong way, healthcare is going to be destroyed for a lot of people. And I try to tell people, look, everyone you know is going to be affected, everyone, because of the protections that we put in the Affordable Care Act. And then there'll be a lot of other people who are really vulnerable who will be especially adversely impacted. So I just don't think they believe this is a priority issue for them.
And Leslie, I would go even farther because I agree with Bob, it's not a priority. I also think that it's the way they view the world. I mean, Medicare passed with Democratic votes. Medicaid passed, with a Democratic president and a majority of Democratic vote. And it's just a different view of the world that, we really do believe it's a basic human right. We may have different ideas on how to structure it, but we believe it's a basic human right. And they really do believe it's a privilege, and it's not something that's essential. And I think also it goes to just an underlying feeling of the role of government. And so I think our Republican colleagues feel that if you need insurance, go buy it. There's a lot of private insurance companies, or get a job with good insurance. I mean, what's wrong with you? Why don't you just go buy insurance, and that somehow competition among private companies will always, answer the situation, and not the reality of what happens with something that you can't walk away from, that you have to have. And the other thing that I think they don't connect with, and this was our argument in Michigan in expanding Medicaid, is that, we all pay for it as taxpayers, whether we're paying attention to it or not, because when somebody's using the emergency room, which is the most expensive way to get health care, rather than having health insurance and being able to take their child to the doctor, insurance rates go up for everybody. And so it's not like you can say, well, I'm not going to get health insurance, and therefore I refuse to get sick. I'm just going to refuse to get sick. I'm not going to get sick. The reality is that you're going to get sick anyway, and somebody in your family is going to get sick anyway, unfortunately. And it's just that everybody else is going to pay for it in the most expensive way, because we don't have a system that allows you to get preventative care and go to the doctor and get what you need on the front end.
Senator Klobuchar's husband got sick, even though he didn't plan on getting sick. Thankfully, now he's better.
That's right.
But you were just in the medical system yourself that way. I don't know if that.
Well, he is, we've now had 4 million Americans that have had coronavirus. Everyone in America knows someone who got sick to some degree. Many people know people who lost someone, or they lost someone in their own family. And I think one of the things that we've seen over time is, we know it's completely unpredictable. Yeah, my 52-year-old husband got really sick, but my 92-year-old dad didn't really get sick at all when he got coronavirus. He just lost his appetite and survived in his assisted living, even though 3 other people have died. And so for me, having lived through this and knowing how many other people have done the same, there's just no way, I just look at this politically, the people are going to just believe every lie the president says. They know very well he could have gotten ready sooner. They know that we should have had the testing ready, that he should have had a jump start on the vaccine. And they know he's told people a bunch of things that aren't true. That's why they believe in their governors for the most part, and they don't believe in the president. And then on top of that, and I think you'll hear this loud and clear in the Senate races and in the presidential, they are still trying to take the health care away. And I look at the pandemic, it's come near and dear to people now. What is it? Like over half of people have a pre-existing condition. And now people are more and more grappling who maybe weren't got that sick before, or young people who, even if they didn't get that sick from coronavirus, someone in their family did, or their grandma did. They're going to get this in a very visceral way this time. And I think it just strengthens our case to say we should build on the Affordable Care Act with the public option and other things that Vice President Biden and so many of our senators want to do, instead of doing what Trump wants, which is to go backwards. And I think that pharmaceutical issue is still out there as well, is that so many of us have worked on that to make prescription drugs less expensive, with negotiation under Medicare and all of those issues. And we know that wasn't in the ACA to any real degree, although there was some help for seniors to pay for prescription drugs. But what I've heard, having been out for some reason all over the country last year, is that people want to build on the Affordable Care Act and not tear it down. And the pandemic has even made that much clearer.
Yeah, we could go on. I want to give Senator Baldwin and what will be the last word in this. And can I ask you to reflect on one thing too, and then of course take it anywhere you want. But the country's also been roiled by issues of racial injustice and over the last several weeks, and of course over the last several years. And this is an area where healthcare and healthcare disparities have become so clear in COVID and the response. I just wondering if you could touch on that as well.
Yes.
That's how you want to close us out in any way.
Sure. Well, let me start there because last year before the pandemic hit, the County of Milwaukee had voted a county ordinance in to declare racism as a public health issue and crisis. And so early on in the pandemic, when states and public health departments at the local level started posting data, they were one of the few communities really across the country that broke it down by race, ethnicity, gender, and other factors. And so there was several weeks that went by before there was a common knowledge that this disease was disproportionately harming and afflicting communities of color. And it provoked, I think, really starting with a conversation, but obviously action has to flow about all the reasons that might be, whether it's access to health care, presence of pre-existing conditions, multi-generational housing, which made isolation or quarantine next to impossible, or jobs in the workforce that were considered essential before we had, well, we still don't have any sort of mandatory plan on how to keep workforces safe, but in that time where grocery stores, where assisted living, senior care centers, hospitals, etc., were all deemed essential, that too had a disproportionate impact on communities of color who make up a significant portion of what is known as the essential workforce, and disproportionately in the low-paid jobs in those, in those systems. So the pandemic, in many ways, lifted a veil, not one that no one saw through, but really exposed for the whole nation how inequitable our systems are. With regard to work yet to do, I just want to say, beyond his efforts to overturn the Affordable Care Act in court, you have to look at the number of things that this president has done to slowly and sometimes not so slowly take away needed protections people have in the healthcare system. Everything from narrowing the window for the open enrollment period, defunding what are called navigators that help people literally navigate their choice of an appropriate healthcare coverage that they can afford. And then this expansion of something I call junk plans. Many people refer to them as short-term policies that are exempt from the protections in the Affordable Care Act. But I don't know that when they were expanded to 3 years that anyone considers that short-term anymore. These are junk plans. And for purposes of the COVID pandemic, these individuals with junk plans are literally considered uninsured because that's how little their junk plans are worth, and exposing them, of course, to significant risks for out-of-pocket, being left with the bill themselves. As we build back this system, as we achieve the sort of political change necessary to go back and strengthen the Affordable Care Act, one of the things we've been all talking about a lot, and so has Vice President Biden, is how we build back better. We don't want to go back to the pre-pandemic days with these gross inequities, with still many dealt out of the healthcare system, with access being a problem even when you do have some coverage, We want to build it back better, which means strengthening the Affordable Care Act and putting an end to this sabotage.
If only they would put half as much energy into saving America from this pandemic as they have in the Affordable Care Act, we'd be a lot better off. I want to be respectful of everyone's time and thank you for just all the work you do every day to make America a better place. I hope you all stay healthy and wish us all a happy November. And maybe we won't have to have this kind of conversation again. And we can indeed build back better. So thanks to all of you. And now let's get Mitch McConnell to get us a decent bill and help people. Thanks and have a good evening.
Thank you.
Thanks,
Thank
Leslie.
you. Thank you. We're going to take a minute and a half just to switch panels. We'll show an ad that we've just begun to show today. And then my colleague Adam Hoyer. Yes, my colleague Adam Hoyer will lead the second panel. Thanks, everybody.
After 7 years of promises to repeal and replace Obamacare, it came down to just one vote, John McCain's.
Senator John McCain, just days removed from his cancer diagnosis, stunning the chamber, turning the thumbs down on the repeal bill.
Republicans have tried to dismantle our health care dozens of times. Colorado Senator Cory Gardner, Iowa Senator Joni Ernst, Montana Senator Steve Daines, and North Carolina Senator Thom Tillis all supported repealing the Affordable Care Act. And Arizona Senator Martha McSally said, "Let's get this thing done," when calling for repeal. Now we're in the middle of a pandemic, and President Trump and Republicans are back, again, continuing their relentless quest to repeal the Affordable Care Act, which provides coverage for more than 20 million Americans and protects over 135 million Americans with pre-existing conditions. It's reckless and dangerous, especially in the middle of a pandemic. In times like these, Americans deserve better. It's time Republicans drop their relentless war on our health care.
Hi, everyone. Sorry, just catching up with some old friends here. It's an honor and a privilege to follow that great panel of senators, and it is just delightful to be joined by so many great leaders and activists who helped make that no vote happen 3 years ago. And I cannot believe that it's been 3 years ago. Somehow it seems like it was just yesterday, and at the same time it feels like I have aged 20 years since then. But here we are 3 years later. And before I go further, I want to formally introduce the panelists who are with me this evening. Sister Simone Campbell, the Executive Director of Network, and the leader of the famous Nuns on the Bus trips. Ben Wickler, the current chair of the Wisconsin Democratic Party and former Washington Director of Move On. Elena Hung, the Executive Director and co-founder of Little Lobbyists and mother of healthcare hero Jomara. Lori Lotus, co-founder of Get America Covered, former Communications Director at CMS, and current Executive Director of Climate Power 2020, and Laura Packard, stage 4 cancer survivor, healthcare advocate and activist, and healthcare voter co-chair, and the record holder for most miles traveled on a bus affiliated with the healthcare campaign, I believe, unofficially. So I really am thrilled that we managed to pull this panel together because, you know, I think sometimes in this space we don't reflect enough on our victories. It's always on to the next fight because there are always so many fights to move on to. But this was a huge victory and a unique one in my mind, just because of the chorus of voices that were involved. And I wish that we could expand this panel out to everyone who was instrumental in defeating that repeal effort. But we would be here probably until 2 in.the morning tonight if we include everyone who was instrumental. So I picked 5 of the very best, and apologies to those that I left out. But I wanted to hear from each of you. One, what do you remember about that night? And what do you remember about the fight leading up to it? What was effective? What most sticks out to you? And Sister Simone, if you don't mind, I'd love to start with you, since you were, such a huge part of the advocacy effort that helped pass the ACA in the first place. and fought so hard to protect it after. What do you remember about that night 3 years ago and the fights leading up to it?
Well, it's such an honor to be here and to be here with these fabulous advocates and everybody that's watching. We did this. It was the grand we across the country. And I remember when it happened, I was traveling to give a talk. I was watching the television in the middle of the night. And when John McCain put his thumb down, I burst into tears. I couldn't believe it. It was just so powerful. But I think the thing that I hold so dear is that we in the faith community did all-night vigil on the Capitol grounds to, pray and fast and, make mischief. But we did a lobby visit. I did a lobby visit with Senator Murkowski. And that was 2 days before the vote. And I told her the story of Margaret Kistler, who died in 2012 because the Affordable Care Act had not been implemented at that point, and she didn't have access to Medicaid. She'd lost her job in the recession. When she lost her job, she didn't have health care, and so she got colon cancer and ended up dying. And Margaret's fueled my passion for the expansion of Medicare. So I'm lobbying with the interfaith group. We're lobbying Senator Murkowski, and I tell her the story, I show her the picture, hand her the picture, and I say, I don't understand how your colleagues can turn a deaf ear to the needs of their constituents. The conversation goes on. And then she says, after a couple of comments and beats, she comes back to me and says, Sister, I want to answer your question. Why don't my colleagues respond to the needs of their constituents? It's because they don't meet with them. They meet with their donors. And what you have to change is that reality. And I thought, holy moly, that's exactly it. And that's why our advocacy, our getting engaged, our getting in front of our senators really makes all the difference. And I think John McCain's personal experience and the fact he was connected to people in Arizona made the difference. But I also want to say is everybody out there, you all made the difference because you told the stories.
That's so right. Yeah, the storytelling really made the difference to me. And I know we pay a lot of attention to John McCain's vote, and rightfully so. But to your point, how many Alaskans do we fly in to meet with Senator Murkowski? How many Mainers do we bus in to meet with Senator Collins? I can't tell you how many West Virginians. I didn't know there were that many West Virginians to meet with Joe Manchin and Shelley Moore Capito.
We shook all the hollers. We shook all the hollers together.
That's right. And I'm glad you brought up the all-night vigils. And Ben Wickler, of course, you as Washington director of Move On, you spoke at so many rallies and organized so many events and protests and vigils and partnered with so many organizations in this. And I wonder, in your mind, what were some of the events and tactics that really broke through and were consequential in the fight leading up to this?
So when I think about this fight, the first place I go is that horrible night in 2016 when we learned that the world was going to be very different than we'd anticipated. And I remember right after the 2016 election, the conventional wisdom was that the Affordable Care Act was doomed, that there was no way that it would be saved. The Republicans had passed 87 times through the House. They'd passed their repeal. They'd already passed it through the Senate with their model bill the previous year. I remember talking to senior legislative aides who said that, I remember someone said there was a 100% chance that we would lose that fight, so we should focus on something else. At a retreat of a bunch of progressives, someone got into an argument with me and said, you're giving people false hope if you even try to run a campaign about the ACA. You got to move on to trying to protect Medicare. And, for everyone who got involved in this fight, both for the ACA and for Medicaid, it was kind of a, one of these 1,000,000 to 1 chance, but it just might work kind of battles. This seemed like it might be a kind of important thing to wage on a moral level, but not something that was politically realistic. So my memory was looking at when the tide had turned completely and looking at what happened to the Medicare Catastrophic Coverage Act of 1989, which passed overwhelmingly in the House and the Senate, signed into law, and then repealed a year later. And there was this moment in that turbulent moment where there had been a town hall with a Democratic member of Congress at that time where seniors just kind of like started yelling and then chased the person out of the town hall and ran after Dan Rostenkowski ran after him as he went into his car, surrounded the car. He like fled the car and ran to a gas station, was driven away, all on camera. And I was like, we need to find some way to make that happen. And so the tactic that I think of that made the biggest difference is these moments when people had to confront people who would be directly affected. It was the town hall meetings in February across the country where people stood up and said, you know, this could cost me my life if this bill passes. And then it was the work by people with disabilities, by the little lobbyists and the families of kids with complex medical needs, and people from ADAPT, people whose lives were on the line, who put their bodies on the line. And then millions of us raised our voices, spoke at rallies, did vigils, made phone calls, did all these other things that helped to make clear that it wasn't just those who were had the most to lose at that moment. It was everyone was united in their incredibly powerful feelings about it. It was a fight that, for me, just revived my belief that democracy could still operate in this country. And I will never forget that moment on the night of this vote. Elena was there. We were a couple feet away from each other, standing outside the Capitol. I had woken up that day with this pit in my stomach. I thought we were going to lose that day. And I thought we were going outside of the Capitol for that last protest to just bear witness and shame the people who were going to vote to harm millions of Americans. And we got out there at 8 o'clock, and for some reason things were moving slow. And we went through our speaking program, and then we just started handing around the mic. And everyone who was there at the protest wound up speaking, telling their own stories, talking about what it meant to them. And still we thought we were going to lose. And then the news came that Lisa Murkowski had voted no, and Susan Collins had voted no, and then John McCain had put his thumb down, and we just exploded. And so many of us started crying, like this incredible sense of relief, and then this sense of joy that the impossible had happened, that this uprising had moved mountains. It opened the door to things being politically possible that no one had dared to imagine at a time of incredible darkness for our country. And for me, there's a direct line between that moment and the wave in 2018 and what's to come this November 3rd, and the revival of democracy in this country, as well as the fight to make sure that every person has the healthcare that they need.
And I'm so glad you mentioned ADAPT, because they are first and foremost among those I was thinking of, and we invited a few members of ADAPT to join us. They couldn't, but to me, that maybe as impactful and memorable to me as that moment, the night of the vote, was the moment when they took over Cory Gardner's office in Colorado. And it was just, to your point, and I'm old enough to remember when Republicans actually held town halls, but I felt the same thing. It's like we had taken control of, the narrative in those public settings. And Elena, speaking of storytelling and effective storytelling and meeting with members, you founded Little Lobbyists on the onset of this repeal fight, if I'm not mistaken. Can you take me back to that moment? What made you realize that you had to tell the world about Jamara, and what was the response like from other families that you reached out to?
Yeah, thanks, Adam. I just want to say I have goosebumps from hearing Ben tell that story. I've heard tell it 8 million times and I was there, but oh my God, what a night. Of everyone here on this panel, I'm probably the newest one. I am the newest one to all of this. A month before that night, June 2017 was my very first time on Capitol Hill. No lobbying experience, no political advocacy experience, no organizing experience, no healthcare policy, none of that. Like, I was watching the news like all of us were, and just got really, really scared, really worried, really angry. And I noticed what was not being shared. Stories like mine, with children who were born with medical needs, who required medical care for for the foreseeable future, and really wanting to have my daughter's story be told. So really, I showed up. I showed up one day, June 20th to be exact, and started speaking to senators, just walking into different offices, and really tying in the story to to the policy piece. And for me, that was the lifetime limits. So we all talk about different parts of the ACA that's important and what was at stake. And for families like mine with children who have spent time in the hospital, with Xiomara, she was born with a number of medical issues and spent the first 5 months of her life in the neonatal intensive care unit. And not many people know that prior to the ACA, if you had insurance plans at the time, usually there was a lifetime limit, meaning that if once you reach that limit, the insurance company can just cut you off. And for so many kids like mine, that meant that they would lose their insurance before they even went home. So we weren't seeing that piece being told in the media. And so we said, well, we'll tell it because we know it. And so that's what we did. But leading up to that night was just, nonstop, go, go, go. A lot of text messages from Ben telling me to show up when and where. And learning all of this from everybody. So I guess, for me, not having any experience in advocating, but being able to meet with others and feel that energy and just that collective we that Sister Simone talked about, that was there. I was there that night. I was there till, I think, 3:30 in the morning. I was still there after you left, Ben. And I was there with Xiomara, way past her bedtime. I remember the metro was closing, and I didn't want to leave. And so I called my friend, and I was like, can you come and give me a ride? Can you come and bring me an extra battery for her ventilator? Because her ventilator is about to shut off. Can you come and bring me an extra oxygen tank? I was there. I knew in my heart that it wasn't over that night, but I wanted to soak up that energy and be ready for the next fight. So that was an amazing night. I won't forget it.
That's incredible. I don't think I realized that Xiomara stayed up that late past her time.
She fell asleep for a little bit, but then she woke up. She woke up when all the senators came out and hugged us.
Same. Lori Lotus, you were at the heart of this repeal fight in so many ways, and you and Leslie started Protect Our Care to keep the ACA from being destroyed in the first place. You recruited me from Florida to come be a part of it.
I'm sorry, everyone.
You co-founded Get America Covered, and in my mind, you'd been convening 945 calls and running healthcare table meetings since the Reagan administration, I think. But in your mind, what was most effective during that campaign, and what lessons should future causes take from it?
I mean, I think Ben touched on it. Actually, everybody has. But I think what is the best descriptor about it is the night of the vote. And it was, we all had text chains, we were on email chains, and everybody, it was one of those fights that was so not about any individual or any organization, and everybody was just doing everything they could. And so, the night of the fight, we were still trying to figure out, okay, we actually have heard that Murkowski is moving back to a yes. What do we need to do? Like, we were still in the minutes and hours before the vote, doing everything we can to find the right person one last time to talk to Murkowski or talk to Collins, or God bless Senator McCain. What can we get to Ducey this one final time to then call him? And it was like that the entire time. This was not a fight that I wanted to be a part of, to be perfectly honest. I worked on the Hillary campaign, and that night, and the reason I went to the Hillary campaign was because I really did think, along with Secretary Burwell, that it was where I could go to make sure that we didn't have to have this fight again, that we would win, and that we would be best positioned to continue to expanding the Affordable Care Act. And so when Leslie and I started talking, I was just not going to have it. I was just too broken at that point. But it was listening to everybody's stories and talking to so many people, and everybody was on the same page. Like, this was our fight and this was our moment, and we were going to do everything we could. And we thought it was, like Ben said, we thought it was over. And so the first thing we had to do was change that conventional wisdom, even though ourselves, we did not believe that we were going to win. It was prolonging our death, right? And like prolonging how long we could, if we can only make it to Easter, if we can make it to Easter, then we can make it to May. And if we can make it to that May recess, then maybe, just maybe. And it was like that up until the vote. But I really think a few things that worked so well was constant communication. And I think, again, there was no egos involved. Everybody had their role. Everybody knew what each other's role was. And we were in this constant information feedback loop. One of the things that I think was really helpful beyond just all of the stories was Andy Slavitt, Ben Wickler, Topher Spiro opening the doors on what this process looked like. And I don't remember, and Ben, you can correct me, I am sure there may have been another something like this, but it's the first time in my memory where the legislative process was just in some ways completely open up. Andy was going to talk to members of Congress and then immediately texting immediately tweeting what he learned. And I think that sort of information loop was so important and really made everyone feel a part of the moment of figuring out what can I do? I have this information now. What can I do to change this? So I really do think it was everybody doing everything they could. How many phone calls can you get in? Oh, I can actually do more now. And so being extraordinarily transparent across the board. And on this transparency note, and I have not shared this before, I don't think with any of you all or anyone else, on the night of the vote, I have a 2.5-year-old son, a little bit younger than Ben's youngest, they're right at the same age. And I was very, very sick. This was the end of my first trimester, and I was just sick. And I fell asleep at 1:33. Yep. And I woke up when I believe it was Leslie Gott called me at 1:49, 1:50, and I was like, yes, I'm here. Pretending I was watching, and I had been asleep because I was so sick. I then stayed up and worked for another few hours, but quite a night.
Incredible. Yeah, and I remember, after that vote and, the pivot led by you and Leslie, that after repeal failed and looked like it was done for in the Senate, and now trying to figure out how we leverage healthcare to make it a political liability for all of the Republican senators who voted yes to repeal. And, and Laura Packard on the accountability front, I'm not sure that anyone has made a senator pay for their healthcare appeal board votes more than you. We can ask Dean Heller when you were a Nevada resident. And now you're a Colorado constituent of poor Cory Gardner. What drives you to speak at all these events, and what's 2020 hold in store, and what drives you to share your story with so many people and travel so many miles on a bus?
Sure. 3 years ago, I was diagnosed with stage 4 cancer in April. And then May, my first chemotherapy, the day after, while I'm at home trying to figure out what does it look like after you've been poisoned, what's going to break. That was the day that the Republicans in the House voted to take away my health care. And I took that kind of personally. So by the time this vote came around, towards the end of July, I had gone through a few months of chemotherapy, and I had a few more months to go. So I have been doing events as much as I could. The only things that I did were stay at home, see my doctors, go talk to Senator Heller's office. And actually, I had done a vigil the night before the vote, and it seemed pretty clear to all of us in Nevada that Senator Heller was going to vote the wrong way. Even though we begged, we pleaded, we did all kinds of events, we told our stories. I practically talked to every single person in his office, in all of the offices in Nevada and DC, but they weren't listening. And so we thought that our health insurance was going to disappear. And this is something that as I got chemotherapy, as I sat with other patients while we're being poisoned, this was topmost on all of our minds because we're uninsurable without the ACA. So that night, we were not expecting good news, and we were terrified because our lives were on the line. And that's why it was such a relief more than anything when McCain voted thumbs down, because finally, for a moment, we could breathe. That entire year, it had been constant attack after attack after attack. And we knew that this was a momentary victory because it's their mission to destroy our healthcare. And this is a setback for them, but it's not over. It is never over until the people who made these votes are no longer in power. So that is what motivates me. And I'm happy to do my part now and as much as I can, because people who value tax cuts for billionaires over the lives of their constituents should not be in office, period.
You know, for my money, and we are in the business of identifying and recruiting storytellers to share their healthcare story with press and constituents and voters, because it's such an important issue, and because stories like yours are so compelling. But for my money, I have never met anyone who is more effective at telling their story than you, and I really do attribute Dean Heller's loss in Nevada and Cory Gardner's upcoming loss in Colorado in large part to the work that you've done, and so many healthcare storytellers like you. And if I may quickly, and I know we're at the top of the hour, and you have small children that I will let you go to soon. But you know, Lori mentioned 2016, and I ran a field operation in Pennsylvania in 2016, and I know that hindsight is always 2020. But there's two takeaways that I learned from that election that I hope we kind of remember in the 2020 election. And one is that we can never get complacent no matter what the polls say. And two, we have to personalize and localize this election for people and every issue campaign for people. I can't tell you how many doors I knocked on in 2016 where people told me that they thought it didn't matter who they voted for and that things would be the same for them regardless, and it broke your heart. But the lesson learned, I think, is that, you know, we have an issue in healthcare where there's a huge distinction between our side and their side, and there's so many storytellers out there that are relatable to, like yours, Laura, and like yours, Elena. So, are there any last closing words from anyone? Ben, are there any? It's weird not seeing you with a bullhorn in front of you, but do you have any last words of wisdom for folks in 2020?
I will build on what you just said. I'm speaking here from my democracy bunker in Wisconsin, America's battleground. And I will say that ultimately what the fight for healthcare shows, and so many other fights, and the movement for Black lives that is sparking incredible protests across the country, across Wisconsin at this moment, is that human beings speaking at a human level about the impact on their own lives, that grabs people at a deeper place than every statistic and every logical argument that we can muster. That it is the power of our stories and the willingness for people to step forward and use the power of those stories to create change that's greater than themselves. That's the thing that makes the magical difference. And in this election, and in every election, what we see is that people actually connecting one-to-one and having those conversations, and then speaking one to many with the power of their own person. That's what makes the possible, but that's what makes the impossible possible. And so I feel like we're going to experience a moment on November 3rd that reminds us of this moment that happened 3 years ago, where people stepping forward, regular people in every corner of this country, changed the course of history.
Sister Simone, I see you're hoping too. What else is in store from the nuns on the bus? Are we without a bus this year?
Oh, well, as most things are, we're going to do a bus, but it is going to be a little different. But the thing I'm most excited about is we're dealing with a Pope Francis voter scorecard, where we're going to score caring for all of life, caring for the earth, and we're going to score how closely our candidates match up with what Pope Francis would think is a good thing, and then share it around a bit around the country. And places like Wisconsin, places like Michigan, places like Ohio, Pennsylvania, where there's a whole bunch of Catholics who think kind of narrowly. So that's what we're going to be after, is talking those stories person to person, but with the added piece of where faith calls us. Faith calls us to think of each other, and that's what we're going to be about. So stay tuned. I can't tell you more than that, but because we've got a big launch and my people will kill me. So just keep your eyes open.
David, wow, as a Catholic, that warms my heart. Well, listen, it was a thrill to see all of you, and I can't thank you enough for joining us tonight, sharing your insights. We have 99 hugely important days ahead of us to make sure that votes like the repeal vote 3 years ago don't even come close to seeing the light of day again. So I hope everyone stays vigilant, keeps the faith, works hard, and hopefully we have more victories to celebrate to come. Thanks, everyone. Have a good night.
Good night.